Welcome to the One for the Boys charity ball. I'm a cancer specialist at the Royal Marsden Hospital. I'm just going to spend a few minutes trying to give some background as to what the charity is about. The One for the Boys charity aims to raise awareness of cancers in men. If you look around your table for a minute, you'll be shocked to hear that at the present time, 50% of people in the UK will develop cancer at some time during their lives. So this is something which we all need to be concerned about for our loved ones and families. Despite that, with advances in cancer research, if you do get diagnosed with cancer at the present time, you can expect a chance of being cured of over 50% due to advances in chemotherapy, radiation and surgery. It's a worrying fact that despite more women getting cancer than men, actually more men die of the disease. And this is at least partly due to late presentation and men being unaware of symptoms and not seeking medical help early enough. Many men have a cancer won't affect me attitude, which clearly with 50% of men getting cancer in their lifetime is not an appropriate attitude to take. You'll be shocked to hear that even in the UK at the present time, about 1 in 4 patients who gets diagnosed with cancer actually presents in their local accident and emergency. Those patients typically have had symptoms which they've ignored for weeks or months. Their symptoms are often quite severe, and not surprisingly, a lot of those individuals get diagnosed with very advanced and incurable cancers, and that's really what we're trying to avoid. Some data show that early diagnosis saves lives. Bowel cancer, which is one of the most common cancers which affects men, if picked up early at stage 1, a man can expect a 74% chance of being cured of that cancer. If they leave it, if it spreads to stage 4, then the chance of them surviving 5 years or more is less than 10%. 74% to less than 10%. And this is all about being aware. Another issue is that the diagnosis of more advanced cancers leads to more aggressive requirements for treatment, particularly with grueling chemotherapy and radiation treatment. My specialist area is in mouth and throat cancer. If you have a small tumour in your larynx and your vocal cord, it can be cured with a 30-minute operation with a laser by a surgeon. If your cancer presents an advanced stage, you're looking at a more 6 to 7 weeks of radiation and chemotherapy as opposed to that 30-minute short operation. So early diagnosis leads to much better chances of a mild treatment as well. So what should we be doing? What should the men be doing? Well, men need to be much more proactive in seeking medical attention early once they develop symptoms. So if you notice a lump in your neck, you notice a lump in your testicle, if you bleed from your throat or you bleed when you go to the toilet, you have a pain which doesn't go away, or you have a mole which grows slowly, you need to see a doctor, get medical attention and get treatment quickly. The early diagnosis will improve your chances of cure and also hopefully get away with the minimum amount of treatment. As Samuel likes to say, you need to get to love the glove. Men also should be more proactive. There are screening programs for prostate cancer and bowel cancer, some of the commonest cancers in men. And I'm a great advocate of vaccinating boys against HPV infection, the infection that causes throat cancer, which Michael Douglas had to be treated for a couple of years ago. We also, as men, should encourage each other to follow healthy lifestyles and to stop smoking for obvious reasons. So what's next? I think time is overdue for a Blue campaign to increase awareness of men's cancers. I call on all of you, especially the stars of this stage and screen, to support each other, to support this charity, and use your influence to make sure that the message gets out there, that men need to take their symptoms seriously, need to get urgent medical attention, and get a cure for their cancer. Thank you very much.